While you're waiting for the webinar to start, Dr. Schultz has asked that you have a hand mirror with you for the webinar, if you have one easily available. This will help you better understand some of the points that he wants to make regarding younger-looking skin. You can pause this video right now. Just push pause, and that'll give you a chance to go get the mirror, and then come on back, push play, and the webinar will start for you. Welcome to the Bottom Line Experts Live webinar. It's not just about wrinkles, beautiful skin at any age with Dr. Neal Schultz. I'm Sarah Hiner, publisher of Bottom Line Publications and host of the weekly radio show, Bottom Line on Your Health, and I'll be hosting tonight's program. Dr. Neal Schultz is a cosmetic medical dermatologist in private practice in New York City who, for the past 30 years, has been helping make his patient's skin look younger and more beautiful thanks to his strategies for keeping it healthy. He's proud to have been repeatedly awarded the title of a top doctor by New York Magazine and Castle Connolly Medical. He received his medical degree from the College of Physicians and Surgeons of Columbia University and received his dermatology training and board certification at the Mount Sinai Hospital in New York City, where he's appointed as a clinical professor. Dr. Schultz has been a contributor to Bottom Line Publications for nearly 30 years, and tonight we are thrilled to have him sharing his secrets in this special web presentation developed just for our Bottom Line readers. With that, I'll turn the controls over to Dr. Schultz. Welcome, Neal.
Sarah, thank you so very much, and good evening and welcome to our Bottom Line friends, readers, and family. Let me start by telling you just a little bit about myself. I'm a board-certified dermatologist on the Upper East Side of New York, practicing for about 30 years, and most of my practice consists of cosmetic dermatology, but I do lots of acne, and of course, early detection, prevention, and treatment of skin cancer. And I love to teach. At Mount Sinai, I'm a clinical professor where I teach the residents every week, and I'm the founder and host of Derm TV, which is the Internet's first daily skincare show, and I get to share all of my information of 30 years of love and passion for dermatology with all of my viewers. Today, what I'm going to tell you not only will completely change the way you think about your skin, but it's going to change the way you see your skin and the way the rest of the world sees your skin. And most importantly, it'll give you the more beautiful, healthier, and younger-looking skin you've always wanted. This information will actually enable you to change your skin forever. It's based on the power of exfoliation, which has been proven over and over again by my patients in the course of more than 10,000 patient visits a year over more than 10 years for over 100,000 patient visits. And as you'll hear, regular exfoliation is the single most important treatment you can do for more beautiful, healthier, and younger-looking skin. Over the past 30 years of practice, what I see every day is that, unfortunately, so few people understand their skin. It starts with their not being able to identify or interpret what they see in the mirror. And I'll bet that you can't either. And it's not your fault, because no one's ever explained it to you. It's so important, I even wrote a book about it, and the book is called It's Not Just About Wrinkles. Today, I'll not only help you understand what you're seeing, but I'm going to take that understanding and apply it to the most common skincare concerns and issues that we all see in the mirror every day. You'll not only start to think about your skin differently, but I'll tell you how to change it as you never thought you could. If you have good skin, I'll tell you how to get better skin. And if you, like so many people, if you're unhappy with your skin, I'll show you how to get the more beautiful skin you've always wanted. Discovering the key to healthier, more beautiful, and younger-looking skin was the aha revelation of my career as a cosmetic dermatologist, and that's a big statement. I've listened to my patients say day after day. I've heard their complaints. I've heard their frustration. Interestingly, regardless of who they were, where they were from royalty and heads of state to moms and working women, they all said the same thing. I heard a resonating repetition from them of, first, the importance of how their skin looked, and second, how they disliked their skin. But here's the disconnect. They didn't like their skin, but they didn't know why. If you have your mirror, look at your face. What do you see? You're seeing so many different things, but what can you name? And I'll bet the only thing you can name is a wrinkle, if you even have any. I'm going to explain why you don't understand your skin, and I assure you, you're not alone. And I'll teach you everything you need to know to understand it. You can get the skin that'll make people stop and tell you that you've got beautiful skin and ask you, what do you use? Can you imagine that? That can really happen to you. But for that to happen, you need to understand it's not just about wrinkles. It's really all about the color and texture of your skin. And when you hear why, it'll be the same pivotal aha moment for you as it was for me. You'll say, wow, that's so simple. I can't believe no one ever told me that. By listening to my patients, they taught me that beautiful skin is all about color and tone, clarity, the brightness and luster, all things that have nothing to do with lines and wrinkles. These are all issues that are caused by problems with your skin's color and texture. Can you imagine 3/4 of what you're seeing in your mirror right now, are those color and texture problems? After today, you'll understand and be able to finally fix them, because beautiful skin is what you get when you fix dull skin, tired-looking skin, matte skin, large pored or sun-damaged skin, discolored skin, blotchy skin, or even skin that's just out of balance, skin with too much oil, or skin that's too dry, or both, too dry and too oily. That's combination skin. All of these are issues that impact on and then detract from the all-important color and tone and clarity and brightness and luster of your skin. That's what causes your dissatisfaction with your skin. And most of these issues don't even look right with makeup on. The most important thing was that these were issues which I knew I could easily fix with the correct skincare products, which were using newer, more effective cosmeceutical technology and ingredients. I didn't mention lines and wrinkles once. They account for about 25% of your issues. Do lines and wrinkles count? Of course they do, but not nearly as much as color and texture. And after today, your mirror will tell you it's all about color and texture. Look, if you want to put this into perspective in terms of how important these issues are, the reality is that 95% of what skincare products do for your skin is by helping those color and texture issues, not lines and wrinkles. So this is your wow moment. But this is only a high-level view of color and texture and what drives bad mirror days. Let's go a little deeper. The reason you can't identify your color and texture problems is because no one ever explained them to you, and that's simply not your fault. The importance of color and texture is so easy to demonstrate with a very simple analogy. It'll also show you why color and texture are so much more impactful than contours like lines or wrinkles. And it's so very important to remember and realize that color and texture problems can occur everywhere on your face, while lines are confined to just a few small areas. We tend to wear our favorite clothes the most, especially tops like sweaters and shirts, and when many fabrics become worn, they pill, giving it a rough, uneven surface or texture. If you spill some ketchup or red wine, and I know about spilling red wine, you'll get a stain that's tough to remove. And of course, if you wear it enough times, it's going to get wrinkled. So you have a pilled, stained, and wrinkled sweater. A sweater with a red-colored stain, a rough frayed pilled texture, and creases and wrinkles. Now, that's not very attractive, you would agree. Steam the sweater, and the wrinkles come out. What are you left with? You're still left with a pilled, frayed, discolored sweater, just as unattractive. In basic medical terms, if a doctor doesn't know the diagnosis, then he can't prescribe a cure. And very simply, if you don't know what your skin problem is, you can't possibly find the right product. But now you will. If you understand the parts of your skin, then you can see how problems with those parts cause your color and texture problems. Then it'll be so much easier for you to identify your problems. Once you know what they are, then, as I'll show you, it's easy to find the right product to fix them. Knowledge is power, especially with your skin. I promise this will be painless, easy, and even fun, because it's going to make sense. In my textbooks, I learned there are 7 layers in your skin. But as you can see from the brackets on the right side, there's really only 3 layers, and that makes it much easier. And almost everything you need to know, almost everything that's causing 3/4 of your problems, those color and texture issues, they're happening right up in the top 2 layers, the epidermis and the dermis. And you can see the labels on the right side of your slide. The main reason you have an epidermis is to act as a barrier. It keeps the outside world out, like germs and toxins and dirt. And of course, it holds your inside stuff in. At its very bottom are your melanocytes, which are the pigment cells that make melanin, your brown color. The dermis is the second layer, and that's where all the skin machinery is. You can see oil glands, hair follicles, sweat glands, blood vessels, nerves, and that's even where your all-important collagen is. Most of the color issues you have are too much browns or reds. The browns are from your melanocytes making just too much brown pigment, and red simply comes from enlargement of blood vessels in the second layer in the dermis. And last, a lot of texture problems are caused by uneven thickening of the top dead layer of the epidermis, which you can see at the very top of your slide, and it's even shown separate from the rest of the epidermis. That's where the dulling thickening occurs. Not once in explaining these problems did I mention wrinkles. Pick up your mirror again. Your color and texture problems represent most of what you're seeing and most of what's been so frustrating for you. So now you know enough about the parts of your skin to be able to understand your skincare issues. I'll take you through each one, explain what's wrong, and as I said before, and most importantly, I'll tell you which skincare products fix them. Now, I'm going to walk you through these 8 common skincare concerns, and now you'll finally be able to fix them. And when we're done, you'll know 2 things. First, which ones are yours, and second, how can you fix them? We're going to start here with acne oily skin. When your skin's out of balance, which means your oil and water are out of balance, your skin just doesn't look right. And the reason is that if the reason's out of balance is because there's too much oil, you have oily skin. It'll be shiny, your makeup won't set properly, and you may even have acne. Oily skin is caused by your oil glands being overactive. That's easy. They may look innocent on the diagram, but they're pumping out way too much oil. And if you also have a certain mix of clogs or bacteria, then you're going to have acne. First, you need a cleanser and a toner specifically designed to help remove the extra oil and bring your surface oil back into balance. And these are easily available at local drugstores everywhere. If you're acne prone, a chemical exfoliant helps to both prevent and treat acne, very important. It works by dissolving dead cells, that prevents additional clogs and heals existing ones much faster. But much more later about exfoliation, which I must emphasize. Exfoliation is the single most important treatment you can do if you want more beautiful, healthier, and younger looking skin. So with the right cleanser, toner, and exfoliant, it's so easy to restore your oil and water balance and keep your acne at bay. If the reason your skin's out of balance is because your sweat glands aren't making enough water, then you'll have dry skin. It's easy to get dry skin, especially on your cheeks where there are fewer oil glands to make natural oils, which to some extent, those natural oils help you hold on to the water that your sweat glands make. In the diagram, the sweat gland on the right and its duct will look perfectly normal, but your skin will feel tight, or it'll even look flaky. And those are the 2 cardinal symptoms of dry skin. And flaky skin, again, makes your skin look dull, tired, and matte. And the flakes of dry skin up at the top of the diagram, you see those little green flakes, those little green boxes? They don't allow makeup to take properly. So your skin can actually look worse with your makeup on, but I'll come back to that later. Relief and rebalancing are so easy with appropriate moisturizers and very mild cleansers and alcohol-free toners this time. And a low-strength glycolic exfoliant, that'll help to remove the annoying, unsightly, and dulling flaking cells, those green flakes up at the top. And I'll tell you all about glycolics after the next slide. How many times have you looked in the mirror and felt your skin just look tired, dull, and too matte? Take a look right now. This may well be the most important condition that you're going to learn a lot from today. What happened to the brightness and luster? You lost it. You used to have it, but the accumulation of both too many dead cells on the surface of your skin and also uneven piles and mounds of dead cells. Look at those little yellow things up on the top, all different sizes. They've robbed your skin of its luster, brightness, and smoothness. They did by changing a smooth, even, reflective surface into an uneven surface, like rough or uneven with the texture of stucco or even sandpaper. And a rough surface just can't reflect light. And that's what you need. If you want to have a bright, lustrous skin, you see, a rough surface, instead of reflecting light, it scatters the light in 1,000 different directions. That causes your skin to look dull, tired, and matte. Those little yellow mounds up on the top of the slide, the light reflects in all different directions. Your skin can't be bright or lustrous with them. So to fix this and restore youthful luster and a radiance, just remove the extra dead cells. And actually, that's very easy to do. Removing dead cells is called exfoliation, and there are two types, chemical and physical. But chemical exfoliation is far superior, especially with gentle chemicals that dissolve the extra dead cells, which is very different from physical exfoliation, which mechanically removes them or knocks them off. Examples of physical exfoliation are loofahs, microdermabrasion, granular scrubs and cleansers, and even shaving. And as a matter of fact, the reason that men's skin often looks better than women's skin in the 30s and 40s is because men have been regularly exfoliating 2/3 of their face by shaving since they were teenagers. The reason chemical exfoliation is superior to physical is because it's much more precise, predictable, and safer. Sure, physical exfoliants have a role in some conditions, but the reason you don't get as good results with them for most problems is because their results just aren't consistent, they're not predictable, because with all physical exfoliants, those results are going to depend on how long you use them each time, how hard you press, and also what the exfoliating medium is, whether it's granular beads, which are round and smooth, or whether it's angular nutshells, which are very sharp. The bottom line is it's very difficult to get consistent, reproducible results with any physical exfoliant. I mentioned exfoliation before when I was talking about treating and preventing acne. And what I casually mentioned then is so important to you that I have to repeat it. If you take nothing else away from today, etch this in your memory. Write it on the ceiling above your bed so you'll see it every morning when you get up and every evening when you go to sleep. Exfoliation is the single most important treatment you can do for your skin if you want more beautiful, healthier, and younger-looking skin, period. As a matter of fact, it's one of the 3 essential daily skincare products. And after today, all 3 will be a welcome and must-have part of your daily skincare routine. The 3 most common chemical exfoliants are glycolic acid, salicylic acid, and retinoids. But without any question, glycolics are the best, and in my opinion, they're the gold standard. And don't let the word acid scare you, because glycolic, when it's buffered and pH adjusted, is gentle, and it's the best way to remove those dulling dead cells and restore a smooth, reflective, and bright, lively surface. And by the way, I know exfoliation has succeeded, and so will you, when you decide you no longer need foundation. And that happens every day with women who use glycolic-based exfoliants. I see it in my practice every day. This will be quick, but it's so important. How many of you have had the experience of buying really good, even expensive makeup, and after putting it on, your skin not only doesn't look better, but the pores look larger, and the surface texture is even rougher and more uneven? This is so easy to understand if you've ever used mascara. The reason you use mascara is to make your lashes look fuller, wider, longer, and you accomplish that by coating the lashes with mascara so it builds up. Well, if you're not exfoliating your skin regularly and have uneven mounds, like on the diagram, like those little yellow mounds, and you see the aggregate of that is that wavy red line creating an uneven surface, or if you even have dead cells sticking up on your skin, and the dead cells sticking up almost resemble lashes. When you apply makeup to that, you're coating those mounds and cells and creating a mascara-like effect that magnifies and accentuates your uneven skin. Now that's a real eye-opener for most people. Because all your problem dead cells are on the very top of your skin, and that's why they're so easy to fix. Exfoliate, exfoliate, exfoliate. Enlarged pores really take a toll on the way your skin looks because of their terrible effect on skin texture, causes roughness, pitted, and even cobblestone-looking skin. I won't torture you by asking you to look in the mirror because I know that you know exactly where your enlarged pores are. They're on and around your nose. They're next to your nose. They're above your nose, and they may even be below your nose on your upper lip. Let's look at the diagram. Look at the clog in the epidermis and the hair channel, which the oil flows through. Clogs are made of both the oil and of dead cells. Those cells are shed from the wall of the channel. It's almost like an inner skin. Once a clog forms, the oil behind it builds up, makes the clog bigger, and distends the channel, making it and the opening at the surface of your skin, your pore, wider and larger. The bigger the clog, the larger the pore. To get your smaller, normal-sized pores back, all you have to do is dissolve the distending clog. That allows the pore to shrink, and it goes back down to its normal size. Not so hard to do, especially with glycolic exfoliants, to dissolve the clogging clumps of dead cells which are mixed with oil and the enlarged pore. Here we are again, exfoliants to the rescue. And this is a case where you can get a synergy between gentle, controlled chemical exfoliation and physical exfoliation by using a scrub with round, smooth granules at the end of your shower after your skin and pores have been steamed open. The round granules can gently help to physically dislodge the clogs that your glycolic exfoliant has softened and dissolved. So it's exfoliants to shrink your pores and keep them invisible. No more pores. What a happy ending. Did you ever say to yourself, brown, brown, go away, only to have it not work? I'll tell you how to make it work. Brown is so easy to understand and also to fix. So first, the why. Let's look at the diagram. Brown discoloration is caused by too much brown melanin pigment in the normal layers of the epidermis or in extra thickened dead layers of the epidermis, and unfortunately, sometimes in both. This occurs when the melanocytes, the brown dots, start making too much brown melanin and are pumping it into all of the layers of the epidermis. The reason that this is happening is that when the skin is injured, regardless of cause, those melanocytes make extra brown melanin pigment, whether it's a UV injury, a hot pan from cooking, or even a scratch from your dog or cat. This is one of the ways the skin tries to protect itself from additional injury, like UV damage from the sun. And brown is even worse in skin that hasn't been exfoliated. Remember the mounds of dead cells? Well, now imagine those mounds also with extra brown pigment in every cell. So you have extra layers of dead cells, each cell and each layer with too much brown, making the intensity of the brown staining in your skin worse. Fixing this brown discoloration is easy with 3 synergistic skincare products. First and most important, because the sun stimulates your melanocytes to make even more extra melanin, then you can remove with the antioxidants and exfoliants that actually can decrease the extra browns. The most important step in reducing unwanted brown is effective sun protection to prevent UV from making things even worse. Sunscreen again. And I never tell my patients to stay out of the sun, but instead I tell them how to protect their skin while they're in it. So use a sunscreen with an SPF of at least 15 to 30 with UVA or broad spectrum protection applied daily, and so importantly, reapplied frequently. Okay, second, you need to remove the extra layers of dead cells that already have too much brown in them. Remember the mounds? That's easily done by regular use of a glycolic exfoliant. Exfoliants again. And third, use a vitamin C-based topical antioxidant because it also helps to reduce extra brown pigment. We're going to discuss antioxidants and particular vitamin C-based antioxidants a little bit later. Okay. In addition, there's one other very helpful product here. By using what we call SMART hydroquinone-free bleach, which stops only the overactive melanocytes from making extra melanin. That's the extra brown stuff. That stops the inflow of extra browns exactly where you need it. In addition to the browns, red colors and hues are the other types of discoloration. If any of the blood vessels in the dermis enlarge, they carry more blood, and the extra blood is red, of course, and in those larger vessels, it actually shows through the epidermis as the color pink or red. If the blood vessels are only slightly enlarged, you see like a pink blush or a blotch. If they're even larger, you can actually see them as individual, squiggly shaped red, pink, or purple lines, and we call them spider veins because we call them that because the shape actually looks like the legs of a spider. And by the way, they're also called broken capillaries. Spider veins, broken capillaries, all the same thing. They can be enlarged because of damage from repeated UV exposure without sunscreen over years and years, or because of acute injuries like cuts or burns, and of course in patients with rosacea, they have enlarged blood vessels. In all of these cases, the body is purposely enlarging the vessels to carry more blood to help bring nutrients to help and aid in repairing the injured skin. Unfortunately, this is a problem not currently addressed by at-home skincare products, but I'm going to tell you later how to even get this problem fixed. Sun-damaged skin can mean a lot of things, but here I'm talking about that weather-beaten look. Sun-damaged skin is the combination of dull, flaky, tired-looking skin, brown blotches and spots, with bunches of broken capillaries, spider veins, and pink blushes thrown in. It not only makes you look so much older, but your skin just looks unhealthy. And you know something? Unfortunately, it is unhealthy. This is an awful but all too common composite made of a combination of many of the conditions we discussed before, but especially dull, flaky, tired-looking skin and brown spots, and even early abnormal sun-induced changes which border on precancerous. And this is all caused by years of repeated, unprotected sun exposure. I explained before how easy these are to fix with exfoliants, bleaches, topical antioxidants, and that even includes the abnormal stuff, because an additional benefit of glycolic exfoliation is its ability to actually remove a lot of the early abnormal cells which otherwise would go on to become precancerous cells, which then become precancerous skin growths like actinic keratoses, and those are the growths from which squamous cell cancers come. So topical exfoliation can actually improve the health of your skin. But just listen to the logic of this. If you're not using sunscreen, if you're not into sun protection, why bother with anti-aging skincare products, procedures, and so on? Why fix the old stuff if you're not going to prevent new damage? I just said this is all caused by years of repeated unprotected sun exposure, and as a matter of fact, every condition I discussed other than oily skin, every one is in part caused by or aggravated by unprotected sun exposure. So it goes without saying that daily use of and reapplication of sunscreen is a must. Isn't it just easier to prevent all this stuff? Next, and very importantly, topical antioxidants help by synergizing with sunscreen to help protect your skin from premature aging, whether it's brown discoloration, red discoloration, rough, dull skin, lines, wrinkles, but maybe even more importantly, topical antioxidants also help protect from the precancerous and cancerous effects of UV exposure. Topical antioxidants, as opposed to oral antioxidants, are especially effective on your skin because they're absorbed directly into your skin cells, and that's where you need them to work. And by direct absorption into the skin, you'll get a much higher level of the antioxidant than you can ever get by taking antioxidants orally. You see, while sunscreens work from the outside, antioxidants work from the inside out. And once they're in your cells, they work by absorbing and neutralizing the dangerous energy that's released by free radicals and reactive oxygen species that could otherwise break DNA, cell membranes, and which aggressively promote the visible signs of premature aging in your skin. And of course, they cause skin cancer. And finally, of all the different types of topical antioxidants, vitamin C-based antioxidants also help to fix unwanted brown discoloration by decreasing the formation of that unwanted extra melanin pigment. There are skin conditions that sunscreen, exfoliants, and topical antioxidants, even when helped by other products, conditions that you just can't fix at home. And for a lot of those problems, in-office procedures with lasers, fillers, Botox, Dysport, and chemical peels may well help and may be the answer. But in particular, for red skin, I mentioned that no at-home products really are effective. And by the way, a topical product that fixes red skin, that's going to be the next hurrah, the next important invention and accomplishment in topical skincare. But no at-home products work now. But those reds are easily fixed with laser treatments that are easy and painless. I do those procedures for my patients every day. But if you have any of the other 7 skin concerns I mentioned today, I'll tell you how to find the products you need to finally fix them. In a nutshell, here's what I prescribe for my patients to give them the skin they've always wanted. And really, this is the logical conclusion of everything I've told you about today. Every day, rain or shine, make sure you use the 3 daily essential skincare products: a sunscreen, an exfoliant, and a topical vitamin C antioxidant. They all work together to help your skin by repairing old damage and preventing new damage. The exfoliants and vitamin C-based antioxidants, they'll help to repair previous damage. And the sunscreens and all antioxidants help to prevent future damage. So if you want the skin you've always dreamed of, if you want more beautiful, healthier, younger-looking skin, make sure you use a sunscreen, exfoliant, and topical antioxidant every day. These 3 daily essential skincare products, used in over 10,000 patient visits a year for the past 10 years, that's more than 100,000 patient visits, have been giving my patients the skin they've always wanted.
Wow. Thank you, Neal. That was terrific. There was so much information. And I'll let you catch your breath for just a moment. We've gotten a...
Thank you.
Right. Here, breathe before we move on, because we've gotten a whole bunch of questions in from listeners. So in a few minutes, I'm going to put you back on the spot again, and we'll go through, have you answer some of the questions that people have been submitting. All right? So breathe for a sec.
Breathing is so overrated.
Breathe when you're dead, right? Okay, but before we get on to that, actually, before we get on to the questions, I want to share with everyone what you and I talked about yesterday, which is that because of our long-standing relationship of you with Bottom Line, that we're going to make these same products that you give to your patients, and we're going to make those available to the listeners of this webinar. So then they can get that same beautiful, young-looking skin that your very demanding New York clientele gets. So can you tell them about what the products are that we put together?
Of course.
Thank you.
I put together my 3 best and most effective products that almost all of my patients use. And it should be no surprise at this point that they're the 3 daily essentials I've just talked about. So here they are. Here are the same sunscreen, glycolic exfoliating pads, and vitamin C antioxidants that my patients use and love. First, the Maximum Solar Defense Sheer Cream SPF 50 offers maximum UVA and UVB protection. It's sheer, it's invisible on application, and simply the best sunscreen I've ever encountered in my entire career, which again is a pretty big statement. It's a perfect statement. It's a perfect sunscreen for people who don't like the feel and they don't like the look of wearing a sunscreen. Next, the Advanced Exfoliating Therapy pads are 10% glycolic. They're pH adjusted, they're buffered, and they are driven by my proprietary exfoliating compound, tetrafoliant, for even faster results. And besides being as gentle as they are effective, they're incredibly convenient because they're put on with a pad, and it takes 3 or 4 seconds, and you're done putting on your exfoliant. But last, my Protective Vitamin C Antioxidant Serum has not just one, but it combines 2 clinically superior vitamin C-based antioxidant ingredients. It gives you the synergy of great antioxidant protection and helps prevent and reduce unwanted brown pigment. Now, all of these products are appropriate for all skin types, and depending on your condition, they should provide a 2 to 3 month supply. And I'm sure they'll do the same thing for your skin that they do for my patients.
Well, and your patients, as I said, they are very demanding patients. So, and the Bottom Line readers are very demanding customers as well, so it's a perfect fit. So you and I talked about actually that we were going to get the friends and family discount for all of the listeners, which puts these 3 products, I think normally would cost $197, and we're giving them, you're very generously giving them a 35% discount to $129, plus shipping and handling, of course, but $129 is the price for these 3 items for a 2 to 3 month supply. So that is a great value, because I know how much skincare items do cost. So let me just tell everybody that anyone who wants to order now, there's a green button to the left, the bottom left of the screen. It's in between the gray box and the big green box. It's on the left-hand side. It says, click here to order Dr. Schultz's Daily Essentials Kit. Anyone that wants to order that, you can do that now. We're still going to go on and talk about and answer those questions. You'll still be able to hear the answers to those questions. You won't leave the webinar. So you can check out that page right now, or you can check it out when we're done. That page will be up and available for as long as you want. All right. So have you breathed enough, Neal, so that we're ready to do some questions?
I'd love to do some questions because I know how attentive the listeners have been, and I want them to get the most out of tonight's webinar.
great. And as I said, they've been very active. So we have a lot of questions we're going to answer. I don't want them to be on all night long, so we'll do a few questions now, and then we'll have you answer the questions, and we'll put them on a website. We'll send an email. So everybody should watch their emails to get those answers, okay? All right, so let's start out. All right, let's start out talking about moisturizers and SPF. You mentioned sunscreen. So I have a question from Mary in North Dakota. I'm using a moisturizer with SPF. How often should I reapply throughout the day?
Well, the easy answer to that is sunscreen should be reapplied every 2 to 3 hours and immediately after swimming or sweating. But that's assuming that we're doing outdoor activities. If you're putting on a moisturizing sunscreen, and by the way, I love combination products. You get 2 for the price of 1, and this way you can't possibly make the most common mistake that women make with skincare products, which is putting on their moisturizer before their sunscreen, thinking their sunscreen should be closer to the sun. Actually, sunscreen always goes on first, but with a combination product, sunscreen, moisturizer, they go on together, and that's perfect. But the reality is, if you're putting on your moisturizing sunscreen and going to work, and you're putting makeup on top of that, if 3 or 4 hours later your makeup is still intact, then your moisturizing sunscreen is still intact. But if you're out and active, then the rule of thumb is every 2 to 3 hours and immediately after swimming or sweating.
All right, terrific. All right, now I have a question from a woman named Jean. How do I deal with my tiny broken capillaries that are on my face?
Well, unfortunately, the broken capillaries really are not addressed by any skincare products at this time that would be considered safe. But there are 2 important points here. Number 1, and of course I mentioned that these can easily be fixed by in-office procedures with painless lasers that don't leave any marks. But the 2 important things to realize here are, number 1, if you see a product that's advertised that's going to take your red away, a topical product, I think you have to be very skeptical. The only thing that I know that really does that is makeup, is concealing or covering it. But I don't know any product that works to actually reduce the redness. But number 2, redness is only a small part of your whole complexion, of all of your color and texture. And despite the redness, I have to reaffirm and tell you again, make sure you're using your sunscreen every day, because the redness makes you more susceptible to burning. And make sure you're using your exfoliant every day to get smoother skin so that the texture is better and there's more radiance and luminosity. So even though there's some pinkness there, there are no other distractions or detractions from the beauty of your skin. So beware of products promising to fix red. See your dermatologist to get them fixed, but make sure you stay in touch with sun protection and exfoliation and topical antioxidants, even with those red broken capillaries.
Well, and again, as you said, that beauty and beautiful skin is so much more than just a few broken capillaries, because it is part of the glow and the color and the texture of the overall skin that's really making the difference.
That goes back to what I said about women telling me about the importance of how their skin looks. They were talking about the whole picture. They were talking about everything you see in the mirror. But before tonight, it was hard to separate those parts out. Now that you can separate all those parts out, you know how to attack each one of them, and you know how to fix them. And let me tell you, after a talk like this with the kind of information we've discussed, it really, really is empowering to have that information.
Absolutely. All right, let's move along. I've got Rita, who has a high school-age daughter, and she is an athlete and sweats a lot. So is there anything that she can do to clear up and prevent the teenage acne?
Well, teenage acne is a very important issue, especially in kids who are athletes, because they go from classroom to the playing field. And what a lot of people don't know is that the most important time of the day to wash your face is before you do activities that cause you to sweat, not after you do them. And the reason is, up until the point you do that activity, through the course of the day, you accumulate oil on the surface of your skin, dirt, air pollution, all sorts of things. And what do you do when you sweat? You wipe it off. Well, when you're doing sports, you're not taking a towel and tissue and blotting it off. You're taking the back of your hand, the back of your sleeve, and you're rubbing it off. And what you're doing is grinding all of that extra oil that's accumulated, the dirt, the debris, the dead cells. You're grinding it into the cells, into the skin, and causing more blocks and aggravating the acne. So number one, make sure that they wash their face before they do their sports. So you're going to say they don't have time to do that. And you know what? I know they don't. And that's why I have those kids use pads that are soaked with toner that they put in cases in their pocket. We actually make them for our patients. We call them anytime pads because you can use one of these pads to wipe off all of this stuff anytime on the way to sports, and that will go a long way towards slowing this down. But of course, anybody who's acne prone, again, has to get a cleanser and toner that will reduce oil, and if you're very oily, the toner should have a little alcohol in it. A little alcohol on your skin isn't bad. And of course, to help prevent the clogs and to help improve and cure the pimples faster, make sure you're using a lightweight exfoliant, glycolic preferably, that's appropriate for oily and acne-prone skin.
Great. And is the exfoliant that is in the Daily Essentials kit appropriate for these people that have acne?
Absolutely. Absolutely.
All right. Perfect. Now, how about I have a question from Rose, who had acne, but she also ends up with black spots and patches on her face as a result of the acne. So she also, what does she say? She says, I also need a skin toner to bring back the color of my face to match my skin color. So what can we do to help for people advice for the little marks that are left after the acne?
Those marks, which are brown spots, is unfortunately an all too common experience and example of the skin darkening in response to injury. The pimple is an injury, and in response to that, the skin darkens. Now, sometimes we help it. Sometimes by doing a little at-home surgery and picking at those pimples, that causes more of an injury, and so that causes all the extra brown pigment that we've been talking about. So the first thing we want to do, since again, with those brown stains from the pimples or from any other injury, since the sun makes them darker faster than we can erase them, complete and effective sun protection is so important. Again, I don't tell anyone not to go in the sun. Just use your sunscreen, use the right one, and apply it repeatedly. Having done that, a lot of, especially in acne, there are a lot of extra layers of dead cells. You've got to exfoliate off those extra layers of dead cells because each one of them has extra brown in it. It's just like the mounds we were talking about, and particularly appropriate with pimples. Third, I don't care how old you are, as soon as you can, at any age, start using a topical antioxidant, preferably vitamin C based. Now, all chemicals that are antioxidants are helpful for the skin, but in this case, you need a vitamin C based antioxidant because it helps remove the brown. So these are the things that are most important. And by the way, there are other products available which are called bleaches, and I may have even mentioned smart bleaches earlier, which will only reduce the brown in cells that are making extra brown, not in your normal cells, because you don't want to maintain the contrast between the extra dark stain and the surrounding skin. You only want to lighten that dark stain. So it's really very easy in a methodical way to reduce those brown stains. And as an extra tip, don't pick, because picking makes that brown even worse.
All right. Let me let you catch your breath. You have it in you for a couple more questions in just a minute?
For our viewers, readers, and Bottom Line family, I'm happy to.
God, you are just the Energizer Bunny. All right, so we'll do that in just 1 second. Let me just remind everybody while we're doing the questions that they can order the Daily Essentials Kit. There's a green button on the screen, kind of in the middle of the screen on the left. It says click here to order Dr. Schultz's Daily Essentials Kit. You can look at that order page while you're still listening to Dr. Schultz answer your many, many questions. All right, let's talk about hands, Neal, all right?
Sure.
Allison wants to know if there's anything that she can do to make her hands look younger.
It's so interesting how much energy, time, and expense women put into making their face look younger, and then they ignore their hands. And their face actually looks 10 or 15 years younger than what their driver's license says. And then they go to shake hands with somebody, but they haven't done anything about their hands. And then people realize that they're a little bit older than they look because their hands look much older than their face. So this is probably the second most important area, together with the décolletage, for women after their face. Now, many of the things that I've said about your face are going to apply here. But the giveaway on the back of your hands is dull, flaky, scaly skin and brown spots. Well, you already know what's going to take away the flakes and the dull skin that looks so tired, and that's going to be an exfoliant. And in terms of the brown spots, we need both the exfoliant and the vitamin C-based antioxidant, and perhaps even a bleach. And of course, because all of this stuff has been driven not only by age, but by sun. The thinned skin, the irregular textured skin, the flaky skin, and the dark spots. If you're not into sun protection, don't bother with anything else. So you've got to use that effective sunscreen with an SPF of at least between 15 and 30 with UVA or broad spectrum protection every day, rain or shine. If you can see your hand in front of your face, even though it's cloudy or raining, there is enough visible light coming through those clouds to drag ultraviolet light, which is going to cause additional injury. So please, 365 days a year, use your sunscreen.
All right, and how about moisturizing also? Moisturize the hands as well?
Moisturizers are a short-term fix for actually making the back of your hands look much better as a quick fix. It's not sustained, but as a quick fix by actually hydrating and moisturizing those dead, dulling cells, it makes them smoother and just makes your hands look a little bit better. And look, there's nothing wrong with using moisturizer a few times a day.
Okay, I was going to say, how about after the exfoliating?
After the exfoliating, sure, but I think that's part of general skincare that we really, we've been really focused without trying to go in too many different directions, but there are infrastructure products that everybody needs to use every day, like cleansers and toners and moisturizers. So maybe that'll be our next webinar.
Right. Well, that's the base. Everybody uses that, as you said, but not everybody knows enough to put their sunscreen on every day, to exfoliate in particular every day, and then to use the antioxidants. And that, I think, is really the magic. Somehow everyone knows clean, tone, and moisturize. But I think what we talk about here in the Daily Essentials Kit really is kind of your magic solution that takes it beyond the normal every day.
Clean, tone, and moisturize is baseline to maintain normal skin. What we've discussed today are problem-oriented products to address specific problems which have arisen. So we're talking about taking you from, these products will take you from negative territory to positive territory, as opposed to just keeping you coasting as the simple moisturizer, cleanser, toner does for assumed normal skin. And that's a very big difference.
All right, well, let me ask you one last question, and then we will let everybody get on with their nights. But again, reminding everybody to click that green button that's in the middle of the screen on the left if they want to order and learn more about your Daily Essentials Kit. All right, I have a question from Judy, who said that, I'm going to read it verbatim from her because it was a couple lines long. I have yet to incorporate an antioxidant into my skincare routine, but I cannot decide among vitamin C-based and grape polyphenol-based products. It's my understanding that you prefer antioxidants with vitamin C over other products. So you did talk a little bit about the antioxidants before, and you did mention vitamin C, but why don't you just reiterate again why vitamin C is so unique versus grape polyphenol or any other antioxidants?
Well, actually, grape polyphenols are wonderful, and they have a role, and as a matter of fact, they are part of one of the chemicals and ingredients and one of my proprietary antioxidant ingredients. So she's really included in this question some of the best antioxidants I know. But the resveratrol and the polyphenols that she's talking about don't do anything for brown pigmentation. And again, I love combination products. So if I can get a topical antioxidant that's both going to help prevent excessive brown staining and help remove extra brown, at the same time I'm getting the protection from the free radicals and reactive oxygen species, dangerous energy, then I'm going to go with the combination product. And the vitamin C-based antioxidants I'm talking about, instead of being in the acidic form, are easy to turn into esters. And esters don't burn when they're put on your skin, and they penetrate into the skin much better. And the whole key for a topical antioxidant to work is that you've got to get it to penetrate into the cell. If it just sits on top of the skin, it doesn't work as a topical antioxidant. So I'll give our listeners one more very important tip. Topical antioxidants only work at nighttime. They don't work during the day because during the day they just become a sunscreen. If you want it to work, your topical antioxidant always goes on at bedtime.
This is like tips from Dr. Schultz. Hints and tips. We are gonna do a whole other webinar, I think, Neal. All right. So thank you so much. It is always so great to talk to you, and needless to say, there's so much that we can always continue to talk about. But I'm going to speak also for our listeners by saying how great it was for them to get this inside information from a doctor, one of the top dermatologists that they would never be able to get to. They don't live nearby. It's difficult to get appointments with you. So let me just remind everybody that they can order the Daily Essentials Kit. And again, you're generously giving us what I'm fondly calling the friends and family discount.
Absolutely.
It's about 35% off of what the people in your office actually pay, right? Your patients.
That is correct. That is correct.
So the link, let's see, the button will stay live, or if they click out of this webinar, they can go directly to the website. I'm going to give it a couple times, bottomlineexpertslive.com/Schultz. Now I'm going to need to take a breath, right? bottomlineexpertslive.com/Schultz if they want to order. And again, this 3-step process is so fast and will save them so much money in their future dollars with their skin retaining its texture and color. They're going to be beautiful long after their friends are off to the plastic surgeon, as far as I'm concerned. All right, let me just also remind everybody that we're going to send the webinar to them, so they should watch their email so that they can listen to this again. Again, there was so much information that you provided in this, and I want everybody to be able to really, no pun intended, absorb all that information. So to our listeners, I'm funny, right? I'm funny at 9 o'clock at night.
Sarah, you're right in there.
So anyway, we will send, everybody should watch their emails. We'll send the webinar out so that they can again watch it again. And so thank you, everybody, for Bottom Line, and Dr. Neal Schultz. This is Sarah Hiner, and thank you very much.
Sarah, thank you so much.